Aloha. The Department of Health received 29 reports of positive results on COVID-19 today. One of the cases was a child, and the rest are all adults. Of the 22 residents in the state, 7 are pending further investigation. But of those 22, 15 are from Honolulu, 2 from the Big Island, and 5 from Maui County. None from Hawaii. Incidentally, there are no cases to date on Lanai or Molokai. When I speak about Maui County, I'm speaking about the island of Maui. So there are 204 presumptive or confirmed cases to date in the state, and the vast majority of those are Hawaii residents. 165 of the 204 are Hawaii residents, 19 are visitors. Our surveillance program is ongoing. To date, we've collected over 254 samples. These are individuals who have flu-like illness but do not have the flu, and none of them have shown any positive results. However, having said that, in the samples we've seen over the last few days, we've seen 29 on Saturday, 26 on Sunday, and again today 29 again. We're seeing some sign of localized community transmission. We have continued to investigate aggressively all the cases reported and their contacts. In fact, we are recruiting volunteers, students from the University of Hawaii and others to help with those investigations. Most of the cases we're hearing about now are being reported through private clinical laboratories. To date, there have been more than 8,700 laboratory tests conducted for COVID-19 samples in Hawaii. As Lieutenant Governor mentioned, we're, I think, third in the country now for actually having tested, and I think our testing program is actually more targeted than many states are. So I'm pretty comfortable that we're not seeing widespread community transmission. Nevertheless, this is certainly the time to act. With the recent travel quarantine requirements, we have a chance to lower the curve. We essentially eliminated the cases that we've seen associated with travel. And now it's really a question of us focusing on social distancing. It's okay to go out for a walk, take your dog for a walk, go jogging, go surfing, but do so individually and honor those social distancing requirements. That's the best thing, the only thing we're going to be able to do to lower the curve and stop the spread of the disease in Hawaii. Thank you very much. The vast majority of cases up till about a week ago were travel related. These are individuals who had traveled from other places where COVID-19 was widespread or came into contact with a traveler. Recently we've had more cases where there is no travel history and we don't know of any contacts the individual might have had associated with the travel. I believe that the travel related cases accounted for at least 80% of the cases we've had until late. Many of these cases are still under investigation, so I hesitate to give you an exact number on that. But clearly, we're moving away from travel-related cases and focusing much more now on cases which are locally transmitted.
Okay, and while you're there, from Sandy Oshiro, HPR, she asks, how is the state planning for healthcare workers who will be lost to the workforce because of sickness or deaths because of the coronavirus, and what are the numbers expected to be lost over what time frame?
Well, we recognize healthcare workers, those on the front lines, are at increased risk of disease. In fact, we've prioritized testing for who are symptomatic, so we should be able to identify those who have COVID-19 very quickly. Those and the first responders are on the top of our list for testing. And in fact, the State Health Department will be doing the tests on those where we can get a 3-hour turnaround. We're, of course, wanting to be sure that anyone on the front line is trained, has protective equipment, and the risk is reduced as much as possible to those individuals. They're critical for us in preventing further spread of this disease.
Okay, and another one. This is from Kristen Concilio, Star Advertiser. She says, you mentioned the DOH is creating maps of where localized transmission is occurring. When will you be able to tell the public specifically where the virus is spreading in the community?
We have begun the process now of determining what epidemiologic features are important including case maps. The epidemic curve is being generated. And in fact, we have some preliminary data to show people where we're seeing cases occurring throughout the state. These are maps based on the cases we've seen to date by census tract, and we have it now pretty well tabulated for the state. We're also seeing in the epidemic curve that you keep hearing about, the flattening of the curve. We're at the very beginning of that curve as we see it, but we're starting to see the trend I mentioned, that we're moving away from travel-associated cases to more cases where there is no travel, where we're probably going to be seeing community spread.